Good afternoon and happy Earth Day, everybody. It is Thursday, April 22nd, 2021. Yes, we made it through 2020 and 2021 is well on the way. So we're here for the weekly Nevada County vaccine update. And as usual, the numbers wizard will kick us off with some where we're at and what's new. Ryan, you're on.
All right. Well, thanks for having us as well again this week. Just by way of update in terms of the number of vaccines. So as of today, we're at 64,427 doses administered to residents of Nevada County, according to the state's data. That's around 6,000 since the last time we spoke last week. In terms of percentages, it's still, we have drips and drabs of data. The state's website now has percentages by zip code. The CDC is providing information on percentage of fully vaccinated people. According to the CDC's website, around 26.1% of Nevada County's total population is fully vaccinated. 31.3% of the percent of the population over 18 years of age, and 54.2% of the population of people aged 65 and older, which of course is a much larger group in Nevada County percentage-wise than in a lot of other counties in the state. And that's great, and it's something that's really showing up in our data as we've continued to see cases, but fewer and fewer cases among people in the older and more vulnerable age groups, as well as fewer or no outbreaks among our most vulnerable congregate settings, which is fantastic and shows that the vaccines are working. That said, it's important for us to keep up the pace of vaccination so those benefits can extend to the younger age groups. Statewide eligibility opened up last week and to everybody over 16 years old, and throughout the state and in fact the nation, a lot of places are seeing the pace of vaccine acceptance slowing down somewhat, and appointments slowing down. And so we're focused on outreach efforts and trying to reach the people who are on the fence and try to get as many people vaccinated as possible so that we continue the downward trajectory of cases and can see the end of this. So I think I'll stop there for today.
There, now better. Jill, Nevada County Public Health, how are you keeping busy?
Oh, that is not a problem for anybody. It's probably not a surprise, but anytime we add an activity, it is an addition. There's nothing that we've stopped doing. So this is a small but mighty team of people who continues to conduct outreach, education, case investigation, contact tracing, vaccinations. That's on top of all the work that people are doing all the time anyway. So lately we've been staying busy with efforts trying to expand vaccination availability, trying to bring in some state resources to make vaccination appointments more available and available on the weekends as well. And then also making some efforts to better understand some things about our community. For those that Ryan referenced, where we want to understand those who are hesitant to get vaccinated. We want to understand their hesitancy a bit better. We want to engage in conversations and make sure that we're answering questions if people have them about the vaccine. And then I think as Dr. Trochet was talking on Tuesday, or was mentioning on Tuesday, or was it Wednesday? It's really critical because we are in a race against those variants and additional variants from developing. So, yes, that's sort of a vague answer that covers a lot of ground, but yes, we at Public Health are still staying very busy, and happily serving our community.
And thank you for that. So Dr. Trochet, variants, any new ones confirmed? And what's about I mean, you had a couple of variants have been confirmed, but just isolated cases. But of course, we all assume that there are way more of those variants circulating. Is that the deal?
Yes, that's correct. We know that there are at least 2 variants in our community because we received those test results. But because we don't have the capability of doing a systematic testing of a certain proportion of our positive tests, we really don't know what else is in our community. We can only gather that from what we hear from other counties. And we know that other counties in our region are seeing both West Coast variants, have seen the Brazilian variant as well as the United Kingdom variant. So if it's happening in neighboring counties, I think it is reasonable to believe that it's probably happening in our community, even if we haven't had those results in our community. And yes, it is a race. And so what we would like to do, you know, we want to vaccinate everybody who wants to be vaccinated whenever they want to be vaccinated, but the sooner the better, for us to be able to open up and be back to as close to normal as we can get with the pandemic.
And Dr. Kellermann, sources tell me that the public health clinic up at Whispering Pines does about 325 immunizations a day, 5 days a week, I believe. At that rhythm, are we going to be okay for the fair? Because the fair said that the fair will happen.
Ooh, tough question. Save the toughest for last. It's hard to know the crystal ball. Of course, Gavin Newsom said June 15th, something's going to change. The tier system will go away. And I think but he's not really elucidated much about what that really means. I'm always amazed when Ryan gives his statistics on immunization, 6,000 more from the last show last week. And continue on that trajectory, then we'll have a large percentage of the county immunized. One problem is, of course, in order to achieve herd immunity, we're not sure exactly where that lands. If we got a lot of variants, it has to be a little higher rate, but we think it's probably 70 to 85%. And we headed in that direction, but by June 15th, we will not be there. The fair is in early August. Maybe we are. We're seeing a little bit more hesitancy now and a little slowing down. Placer County is going to stop mass immunization clinics, I think, next month. The good news is that we've certainly proven that immunizations work. Nursing homes have had some exposures, and yet we're not seeing an outbreak. The jail, they have followed guidelines. There's no outbreaks there. And those are the sites we would expect it. So I think what we're doing right now is good. I just don't want to, as Glennah mentioned, that because of these variants, we don't want to have any complacency, particularly if you look at news outside the country, see what's happening in India. I think 350,000 cases every day. And, it's just a huge outbreak there. And, we'd hate to see, some weird variants come to this country. So complacency can't be any part of our philosophy right now. Thanks, Pascal. But I like the fair. I'd like to be there. Hope to see you there, Pascal.
So before we go to questions from our live audience in our Zoom room, by the way, thanks for joining us. And if you have a question, either put it in the Q&A or the chat portion, we'll get to those. Get a couple questions that came in via the townhall@ubernet.com email address ahead of time. So one of them is, what do we know about the vaccine hesitancy in Nevada County, and how is the county addressing that? And that person also added, how can we help? How can I help? I am a fully vaccinated person. How can I help?
I can talk about efforts that we're making to better understand the hesitancy in our community. So we'll be working with a research company to conduct a survey of those that we're seeing are under-vaccinated to try to understand their hesitancy, what might make them more likely to get vaccinated, who they want to be vaccinated by, what are their trusted sources of information, so that we can approach it in a pretty strategic way. When we looked at another county's data, and I'll say the state is engaging in a similar activity where they're working to survey Californians to identify what really is behind their hesitancy. But we looked at a few other counties' data that they've pulled when they've done similar surveys of their population. And one thing that we were really surprised to see when we saw who were the trusted resources, who are the people you trust to talk about vaccine, friends and family was so high on that list. So if you are somebody who is fully vaccinated, if you are someone who has educated yourself and you have good information about the vaccine, or even just sharing your rationale behind why you decided to take that step and get vaccinated, I think if you share that with your friends and family, you could help make a difference in those who are hesitant as well. So we'll have our scientific approach, but there's the non-scientific approach with that friends and family outreach. So yes, if somebody's interested in helping, that's something they can do.
It basically comes down to community, and since we all live here, when talking to people around us and maybe share the experience that you had, and also the rationale of why you want to be vaccinated. I mean, everybody has their own reason. Everyone's reason is good, and people who are hesitant, well, it's okay to have questions, and that's one of the reasons we do this here every week to answer questions. Another question that came in, pretty interesting, was, I'm vaccinated, but I feel like crap. And can my doctor accurately diagnose me for COVID or the flu? And the person added that, why should they get tested since they are vaccinated? So why should they even get tested? Would the test even be reliable?
Well, the test is reliable, and just to be clear, the vaccine cannot give you COVID. So if you've been vaccinated and you test positive, then you've got the virus. It had nothing to do with the vaccine. And obviously you have to be fully immune is 2 weeks after your last shot. J&J, when it gets re-released, it'll be 2 weeks after the first shot, and the other one's 2 weeks after the second shot. The vaccine's not 100% effective. There are 5, 6, 7% of people that can get infected after being immunized and being but their immunity just didn't hit the level to prevent the virus. And so yes, if you got symptoms, be tested. We usually recommend that if you've been exposed to somebody who has COVID and you're immunized, you do not have to quarantine, except unless you have symptoms. And if you get symptomatic from that, then be tested. And then the other proviso, if you're living with somebody that's immunocompromised or would really be affected by COVID, then we do suggest that you quarantine and be tested. So, but you can get it afterwards. It's not 100% effective. It's about effective as any vaccine we've got that's out there, but it's not 100%. So if you have symptoms, be tested. Glennah, you want to follow up?
Yeah, no, I totally agree with you, Dr. Kellermann. I just wanted to mention that although the vaccine isn't 100% effective in preventing breakthrough, what we are calling vaccine breakthrough infections, it does appear that when people do get sick after vaccination, it is effective in keeping you out of the hospital and in preventing deaths. So even if you got infected after the vaccine, you're still better off than you would have been without the vaccine.
And Ryan, do you have you want to add anything there?
Yeah, I just want to emphasize how easy it is to get tested now. We have availability at our OptumServe testing site. It's free. You can get same day appointments. The test is much less objectionable than it was in the beginning when people described it as a brain tickle. Now it's like much more external. Actually, I did it earlier this week, and it was quick and smooth, and like I said, it's much more comfortable than it was in the beginning, and free.
And what's the turnaround time to get the results?
Yeah, I got my results in about 24 hours, so it's very fast as well. In fact, somebody was asking on Facebook, how can I get a test? I need a test with results in a few days in order to travel. And right now, the turnaround time, it's not a guarantee, but it's very fast right now.
And again, the tests, just like the vaccine, are free, and you do not have to have health insurance to get tested. If you go to the OptumServe site, which is the old Summertimes place for those who who don't know who didn't get a test, because actually I noticed on the weekly update with the test results that it seems to have dropped. The testing has dropped off in Nevada County, and is that also something why we maybe have a higher rate? The percentage is higher again for Nevada County, because in the last, I believe the last blueprint update, let me pull that up, would have been helpful if I had done my homework. But so Nevada County, so the positivity rate is statewide is 1.7, and it's 3.1 for Nevada County. Is that partially because not that many people are getting tested, so we get higher positivity rates?
I mean, I would venture to say that, so you're right, the utilization of our OptumServe testing sites, that is down. So in Grass Valley, I think we're down now to 55% utilization, and in Truckee, we're down to 22% utilization. But there's additional testing occurring in the community. So for example, athletes who are playing on sports teams at the high schools, they are getting tested regularly. Healthcare providers are being tested regularly. And so if we're testing those other pockets and there's a lot of disease transmission within those pockets, that's going to increase our positivity rate. Glennah or Scott, I don't know if you want to add to that.
Yeah, I think it's positive because we still got a fair amount of virus circulating in this community that translates into still we're having 7.1 per 100,000 per day was on the dashboard, and improved from 8.1. Still above the state average. I think the state average is 5 per 100,000. So, I mean, you hear Public Health harping on it, and I hope you don't mind, but we could be more compliant. We could follow the guidelines closer. We could be wear masks more frequently and wash our hands and avoid indoor gatherings. You probably heard that one before, Pascal, but I think we can do a better job.
Well, I think it bears repeating, because every once in a while you need to repeat things a few times to be able to reach everybody and all that, and people that need to hear it. And speaking of masks, who wants to go over the current mask guidance for people that are fully vaccinated? So if you're fully vaccinated, because of course, there was a story this morning that a lot of people were like, oh, well, hey, the New York Times says that you don't necessarily need, if you're fully vaccinated outside, you don't necessarily need to wear masks. So what do the medical professional, what do public health professionals say?
Well, you don't believe everything you read, do you, Pascal? You believe everything you hear on Ubinet, you better believe that, but perhaps even the New York Times. Glennah, go ahead.
Well, we are, there are a couple of things. I think we are right now in kind of a transition of guidelines. You know, we have been asking everybody who's vaccinated to wear a mask in public, regardless of what their risk is, because so many people are still not vaccinated. So even if you're vaccinated, we have been saying, when you're out in public, please just follow all the guidelines, the 6-foot distancing, the wearing a mask, washing your hands, etc. Even if you don't feel that you're at risk, it's just a matter of civic duty to set an example for everybody else. Those guidelines may change as more and more people become vaccinated. And it is possible, you know, it's probably safe for someone who's fully vaccinated not to wear a mask in public outdoors. And I think that's what the New York Times article was talking about. So the issue is, at what point in our community are we ready to say that? And I personally am not ready to say that right now, because I don't think we have enough people vaccinated right now. So let's all still set an example and do the right thing. But at some point, when we have enough people vaccinated, we may move that way. Just like we are saying right now that if you are vaccinated, fully vaccinated, and you're exposed to somebody who has COVID-19, you don't need to quarantine. If you have no symptoms, that's great. But in the workplace, those regulations haven't changed yet. So even if you're fully vaccinated, you may still have to stay away from your workplace if you're exposed to somebody with COVID-19. So again, we're in transition. And I know that people like everything to be black and white, for sure. But unfortunately, with this pandemic, as we've all learned, things change, recommendations change. And I think we're right now in a period of transition.
Now, the current guidelines do allow for fully vaccinated people to gather without masks, and for fully vaccinated people to gather with one low-risk household if they're unvaccinated. So I think that's a key reason to get vaccinated throughout this. You know, my kids haven't seen their grandparents, and you know, there were many times when my parents wanted to see them and were willing to take that risk, but I wasn't willing to expose them and potentially have them endangered. And now they're able to see their grandkids again. So that's a fantastic reason to get vaccinated. And more of the guidance accommodates some provisions for being vaccinated. And it's too much to encapsulate in this call, but would encourage people to look at the guidance because a lot of it does have provisions for vaccinations.
Yes, and there's also I believe on Tuesday there was a slight update to the not quite very focused guidelines for events, both amusement parks, fairs, and indoor and outdoor events, be that concerts or whatever events. So that's all that is on the COVID, it's covid19.ca.gov is the main website, and from there you can find the guidance. And if you go to the blueprint for a safer economy, you can put in a business activity and a county, and then it shows you what the current guidelines are. So it's a little more granular than just, well, if you're vaccinated, you can do X, Y, Z. It also really is specific to the county, to the community, and even within the county. Let's face it, there are communities within Nevada County that implemented or had a better implementation of the guidelines, or people followed the guidelines more than in other areas of the county, meaning that when we started out, the east side, so Trochet, had a lot of cases, and now of course the West County has, well, basically 3/4 of the cases are down here in West County, and it's not that 3/4 of the population is down here. So basically, for now, it would be great if we all could be like Trochet and follow the guidelines, follow the recommendations that both public health, that you folks from public health and also the city there has put out, because it is simply it's a good practice, because the results are there, because the cases are much lower than they should be according to the population. So masking, the social distancing, the washing your hands, and the not gathering, it works. So that's really great. And I had one more question that came in here, that the advantage of having many ways of being contacted is that if there is a new wave or a high outbreak all of a sudden in Nevada County, say after Memorial Day or so, are there any ways that the county or the state could enforce the existing rules, or have Nevada County not get out of the blueprint on June 15th? So what if we have another wave? What happens?
All right, well, I'll jump in and say that I think a lot of the decision making up to this point has been based on public health data. And if there is a strong turn for the worse across the state, then my guess is that the state will work to take actions to prevent or to curb that. What that translates into, it's hard to say, not knowing, since we're talking about imaginary scenarios. but I think we can say confidently the best way to get to that June 15th deadline where things will be lifted is to get vaccinated. That's really what's going to keep people from getting sick, so those numbers go up. It'll prevent the variants from being spread and from being developed. And if we want to make sure that we're going to move in the direction that the governor announced regarding June 15th, the way to get there is to take precautions and get vaccinated.
Anyone else want to take a crystal ball and take a guess on what could happen? Because I believe that the question was specifically, so what happens if a county or a region in California has all of a sudden a high incidence in cases, because the governor announced that it would be statewide, so everything would go out. But again, having been on a number of calls with CDPH and GoBiz and whoever else, the guidance is vague at best and allows for a lot of flexibility. And I believe there's always the caveat that if there is a spike, then the date could even change. So that at least that's how I understood it from the various calls. But then again, there was so many calls with so many different things, and pretty sure all of you have more calls, and we're even on more calls.
And as Jill said, if there's a statewide issue, then I would imagine there would be statewide action. If it's a localized issue, it's been the case throughout this that counties have the option of being more restrictive than the state and using their own public health discretion in how they approach that kind of localized outbreak. And I think Nevada County's been great about allowing the public health or the health officers to have that discretion. And so there are still significant powers and authorities that the public health officer has in normal times and in COVID after the June 15th deadline. So, but as Jill said, the key to avoid having to get to a situation like that is to vaccinate our community now.
And I also believe that June 15th is not going to be the date where every order and state of emergency is simply going to go away. I had a query in yesterday after our weekly media update call. Actually, I had a query in to see if there was any indication if the state of emergency that was declared last March would eventually be rescinded. And at this point, from the various responses I got, was that the state of emergency is still going to be in place, so that if there's new rules and regs that can come out, it would be easier to add those.
I understand the desire to ask questions about what might happen 2 months out, but I think if we've learned one thing over the past years, that we simply can't predict what will happen. COVID time is different from normal time, and so it's really hard to predict what will be in place and what won't be in place on June 15th. I think we just have to see how the state does, how our county population does. And maybe the one other thing I would add is that I feel really strongly that the California Department of Public Health, when you ask about regional or county limitations, their desire is to be supportive overall. So if we did have something extreme happening in Nevada County, we would have resources from them, we would have supports from them, because everybody's goal would be to prevent the transmission of this disease and to curb any kind of spike that might be occurring. So again, if we were unique in that, I just want to say that again, I don't think the desire in the state would be to penalize us, but would be to support us.
But so you can't predict what's going to happen in 2 months, but I'm pretty sure you can predict what's going to happen on Friday at noon, to be exact.
Hopefully we are correct in this prediction, and that is that hundreds of appointments will be posted in My Turn. So if people have not been vaccinated yet, they should look at My Turn at around noon on Friday if they want to be first in line to get some of those appointments scheduled.
And just to be clear, those are not just the appointments for, well, you can schedule the appointments there for the Whispering Pines Clinic, but also I believe on the county's website, there's also the whole list of providers that are also, and they're also scheduling through My Turn now.
Yeah, and maybe one other thing to mention is that there's a change in My Turn, a change as of this week, and that when one goes into My Turn and you put in your zip code, there was a default radius of 50 miles that My Turn took into consideration, and they showed you clinics where you could get vaccinated within a 50-mile radius, and their default is switching to a 200-mile radius. So if people want to travel either here, or if people from here want to travel elsewhere within a 200-mile radius, those appointments will show up. I think that's in an effort to ensure that no appointment goes unfilled, and for those who are able to travel, and maybe they'll do something else as they're traveling, but yes, you can find many appointments through the My Turn system now, not just for our Whispering Pines Clinic.
I think that vaccine tourism, that's I'm pretty sure that the GoBiz department had something to do with that, to encourage some sort of tourism. Well, we are at 12:31, so as usual, your a pearl of wisdom or two, please, from each of you.
This isn't wisdom, but if there is anybody on the call who hasn't been vaccinated yet, I will say we have more than just the Whispering Pines Clinic in My Turn. Actually, Docomo's Pharmacy is in My Turn as well, and some other providers. And right now there are a handful of appointments for April 29th. So if you're not vaccinated, go out to myturn.ca.gov right now and get your appointment.
I'd like to say I'm working on a med school reunion with some friends, and we were talking about the commencement exercise when we graduated, and the fellow gave a speech and he said, "You've all worked hard," and we all had, and you got this, this, now you have a MD behind your name and you all earned it, and we all, yay, we did. But he said, but you have to remember you're standing on the shoulders of giants. All the people that are Hippocrates and all the people that moved all through the years that you're standing on. You got a white coat, but you're standing on a reputation of others. And so, it got me to think on the number of people in my life that I'm standing on the shoulders of. And so, as a final remark, just thank those people that have allowed you to become the person that you'd like to be. And as Ryan mentioned, just make sure they get immunized too. Thanks.
I would just like to say thank you to the person who asked about those who are hesitant and what they can do to help. I love that kind of question. I love that our community is filled with people like that. So I just want to encourage family and friends to talk to family and friends. We are in kind of a rush to avoid those variants, but we also want people to get vaccinated at the time where they're comfortable. So hopefully you'll just engage in those conversations if you're comfortable doing so. And we appreciate that.
And at the risk of being redundant, I'll say again, don't wait to vaccinate. If you're ready, go ahead and get the vaccine.
And with that, I'm going to say thank you as usual. Thank you to the four of us. Thanks to our live audience. And we will have this on YouTube in half an hour or so for those who miss it. And I can tell you that people are watching it, and as soon as it goes up on YouTube, people start watching it. So thanks again for being here, and we will see you next time. Bye.
Thank you.
Thank you.